Hi, my name's Dr. Nick Hayward and I've been a GP for the last 18 years in Shipley. On an average day I deal with well over 100 patient queries, some in person, some on the phone and some are just written queries. It's a bit of a workload, but we manage just about. I know at this time of year people can be very worried about a friend or family member who may be vulnerable and struggling with things around cold and heating. If in doubt, you can always ring Bradford Social Care's response line for advice and support and maybe some social service input. Their phone number is Bradford 435 400.
Hi, my name is Jo Standhaven. I'm an advanced clinical practitioner working at Shipley Medical Practice for the last 6 years. My background is practice nursing, which has given me insight into working in general practice and how to connect with my patients and their families. On an average day, I deal with over 100 patient contacts, and I know at the moment a lot of people are worried about how to stay warm this winter. If you need to find a warm space, please visit www.costofliving.bradford.co.uk/warm-space-directory and see what is available in your area.
Hi, I'm Jack Rotheray. I am an administrative assistant and I work at the Sunnybank and Cowdale practice. On average a day I can scan about 150 letters from hospital admissions or outpatient appointments. I know we have a lot of patients who identify as LGBTQ+. Many people and their families don't know where to go for help and support when they're questioning or coming out, especially as trans or non-binary people. Please contact www.mesmac.co.uk for local groups in the Bradford area or www.mermaidsuk.org.uk who do a great job at supporting gender diverse children, young people and their families. Please also speak with the clinician and we can try and offer any other support you need.
Hi, my name's Caroline Hill. I'm an advanced clinical practitioner working for part of the home visiting team for the past 2 years. On average, an average day, our team can deal with around 100 patient queries, which includes care home ward rounds, home visits and telephone calls. I know we have a lot of patients and families affected by a cancer diagnosis. Because of cancer, some people can really struggle, especially in the cost of living crisis. Macmillan offers support to people affected by cancer, including the offer of an emergency grant for those struggling with money. Please visit www.macmillan.org for more information and advice, or if you want to donate any money, you can do.
Hello, my name is Paula Roberts. I'm a healthcare assistant and I've worked at the Willows practice for 15 years. Every day I see around about 30 people, 30 patients. I do wound care, ECGs, blood, ear syringing, blood pressures. I know this has been a really tough year for people. There are about 6 wellbeing hubs across Bradford which provide a range of services for people with physical and mental issues, relationship problems, substance misuse and welfare advice. Please visit www.wellbeingnetwork.org.uk to find out more or ask any of our team for a referral.
Hi, my name's Sarah Cardis. I'm an advanced clinical practitioner and I've worked within Haycole Medical Centre for nearly 6 years. My background is in paediatrics and young people's mental health. This means that I've got a lot of experience talking and supporting young people and their families when they're feeling at their most vulnerable. On an average day, I deal with almost 100 patient contacts, and I know at the moment that a lot of our young people are worried about their mental well-being. If you are one of those or are suffering yourself or are concerned about a loved one, please contact your local practice to discuss about a referral into our Affinity Care Young Persons Contact Service. You can also visit stem4.org.uk or coof.com, which are 2 great websites that support and give resources for teenagers and young people with mental health. If you are in crisis, please do contact First Response on 0800 952 1181.
Hi, my name is Jackie Haig. I am a care navigator and I've worked at Thornton and Denholm practice for 8 years. Every day I help over 100 patients with their various queries. Did you know that if you have a loss of vision, eye pain, red eye or recent flashes or floaters, you should visit a local minor eye condition service. You can find your local practice at www.bradfordloc.co.uk/makes, where they can examine you, treat you and refer you to the eye casualty if needed.
Hello, my name is Dr. Adil Ahmed. I'm a GP at Sunnybank Medical Centre for just over a year. On a day when I am on call doing emergency clinic, I can see 60 patient contacts, which includes e-consultations, telephone and face-to-face appointments. I know a lot of men are suffering with mental illness, but may not be seeking appropriate help. This can be for many reasons, including shame or not wanting to let people down. It may also be because that you just don't feel able to talk about it with your loved ones. 77% of all suicides are in men. Andy's Man Club, it's a great resource where you can get peer-to-peer support and help. And if you want to find out a little bit more about it, just visit www.andysmanclub.co.uk. And also you can speak to any of our clinicians if you want to have a little bit more support or help. Thank you.
Hi, my name is Karen Wood. I'm a coder and scanner and work at Sunnybank and Cowgill practice. On an average day, I can process up to about 300 patient letters from hospitals and other healthcare settings. And I know that at the moment, there are a lot of informal carers out there struggling with concerns about how they will look after themselves this winter and how they will look after the person they are caring for. Carers Resources do a great job of supporting carers across Bradford and Craven. If you would like some more information or advice, please go to www.carersresource.org or ring them on 0808 501 5939.
Hello, my name is Dr. Rebecca Pountney. I'm a GP and I've worked at the Willows Medical Centre for 16 years. When I am on call, I help almost 100 patients. I know that a lot of children have struggled throughout the recent pandemic and can be struggling with sleep, behavioural or toileting issues. If your child is struggling, please contact the health visiting team on 01274 221 223 for children under 5, or the school nursing team for older children on 01274 221 203, or speak with your school team for advice.
Hi, my name is Zoe Edwards. I'm a pharmacist and a trainee advanced clinical practitioner at Haig Hall. As a trainee, on average each day I have about 20 patient contacts, and I know that at the moment some people are really struggling with drugs and alcohol addiction due to the stresses that life's putting you under. If you or someone you know is needing help, please visit www.thebridgeproject.org.uk/services or ring 01274 296023 or email them on bradford.info@cgl.org.uk for advice.
Hi, I'm Paul Sullivan. I'm an advanced clinical practitioner and lead for diabetes services across Affinity Care, and we have around 4,000 patients on our diabetes register. I know diabetes can present a lot of challenges throughout the year, but especially at Christmas when there are extra temptations. We want you to enjoy your Christmas, but maybe as part of your New Year's resolutions, you could visit www.mylivingwell.co.uk for health advice, including access to 12 free weeks of weight management, or speak with one of our team about specialist weight management services.
Hi, I'm Chloe Nixon and I'm a receptionist and I work at the Cowgill practice. On an average day I can speak to up to 100 patients, and I know at the moment there are some parents worrying about the children, especially with all the viruses going around. So if you want any advice, including about sleep behaviour and managing minor illnesses, please visit www.wyhealthiertogether.nhs.uk for great advice from professionals, including the Royal College of Paediatrics and Child Health.
Hi, I'm Beverly Whelan. I'm a data administrator and I've worked for the Willows Medical Centre for 22 years. On an average day, I can help review 85 patient clinic or discharge letters. I know that there are a lot of people who have lost loved ones over the last few years. This can be really hard. Bradford Bereavement Support help people with their grief. This can be a loss at any point in their lives. If you think they may be able to help you, please visit www.bradfordbereavement.org.uk or ring them on 01274 619 522.
Hi, my name is Dr. Robert Mikhoff. I'm a GP and I work at Hay-Hall Medical Practice. On an average day, I deal with over 50 patient contacts, and I know that at the moment there are a lot of people struggling with money. If you or your family are worried about losing your home, please ring 01274 435 999 or visit the Bradford Council website at www.bradford.gov.uk for advice.
Hi, my name is Chantel and I'm the Care Coordinator for Learning Disabilities and Serious Mental Illness. My role involves ringing people and inviting them for their annual health checks. I know a lot of young people are struggling with mental illness, and over 200 school children are lost to suicide every year. If you are a young person struggling with thoughts of self-harm or suicide, or are worried about a young person, please call Papyrus on 0800 068 4141 from 9 AM until midnight every day, or text them on 0786 003 9967, or you can visit papyrus-uk.org for advice.
Hi, my name is Moody and I'm a pharmacist, and I've been at Shipley Medical Centre for the last 10 years. I oversee the pharmacy team, and as a team we see about 1,000 patient contacts a day, and these range from prescription tasks all the way through to long-term condition reviews. We're always looking to try and improve things, and we're always available to be contacted as well. And one of the ways that you can help us is to communicate with us electronically using the NHS app or AirBid apps as well. As well as that, we'd recommend you using the wider clinical network, and community pharmacies now are involved in a lot more stuff than just medication supply. So stuff like checking your blood pressure, and they can report that back to us to make sure that we're reviewing you safely and effectively and efficiently. As well as they're always available for common ailments, so stuff like coughs and colds. And also your new medicines, when they're prescribed, you can always go to them for a review of those, make sure that you're taking them properly, and to discuss any side effects that you might be having. Hope you have a Merry Christmas, and thank you from all of us from Affinity Care.
Hi, I'm Carol Ainsworth and I am a Care Navigator team leader at the Willows, Thornton and Denholm practice. On an average day, my team deal with up to 700 patient queries, including telephone calls, face-to-face queries, prescriptions, online queries and tasks. We get a lot of inquiries from patients regarding dental pain and infections. Unfortunately, we can't deal with this, but if you are struggling and don't have a dentist, please ring 111 to find an emergency dentist who will be able to examine you and give you antibiotics if needed.
Hi, my name is Julie and I am a care coordinator and I've worked at Haig Hall for over 4.5 years. As a care coordinator, I help manage our nursing and healthcare assistant team manage our patients with long-term conditions. My whole day is spent calling patients up, and I know at the moment a lot of people are worried about how they will pay their bills this winter. If you are struggling and need help, please visit www.costoflivingbradford.co.uk for some good advice and links that may help you.
Hi, my name is Rob Dorr and I've worked at the Willows Medical Practice for over 9 years now. I work at the Willows as an ACP, but also work across Affinity Care as a respiratory specialist nurse in our ever-growing respiratory team. In the last few years over COVID, we set up a diagnostic service for people with breathing problems, and over the next couple of years we're hoping to set up services for people with asthma who have frequent exacerbations, and also look at how we care for our patients with COPD. We know this time of year is difficult for people with respiratory problems. The viruses and cold weather make symptoms worse and cause people to have flare-ups. You can get some great advice from the Asthma and Lung UK website, which is to be found at asthma.org.uk. They have a helpline which is open every day, Monday to Friday, which is on 0300 222 5800. And on their website they have lots of useful information about where to keep warm, benefits to help you keep your house warm, how to deal with your disease, how to keep well. You can also ask your GP about being referred to MyCare24 COPD. This is a service which provides phone numbers and medical equipment to monitor your COPD at home, and is a helpline 24 hours a day to get advice on how to deal with your COPD.
Hi, my name's Linda Ward and I'm a receptionist and worked at Cowbell for 15 years. On an average day I can have over 70 patient contacts, and I know at the moment there are a lot of people struggling with loneliness and isolation. Loneliness can be as harmful as smoking and more harmful than obesity. Fortunately, Bradford and District Befriending Network can offer help and support. Please visit www.bradforddistrictbefriending.org to find out how to connect with a volunteer, either over the phone or in person. If you have any spare time, you can also volunteer for this fantastic scheme at the same website.
Oh, hello. My name is Dr. Ike Wachiku. I'm a GP and I've worked at the Willows Medical Center for about 4 years now. When I'm on call, I can help over 80 patients a day, and that includes e-consultations, telephone calls, face-to-face appointments, and other queries. I know that a lot of people are struggling to pay for food for themselves or their family, particularly at this time, or they may be homeless and not know where their next meal may be coming from. BradfordFoodBanks.org.uk has advice on where to get emergency meals and low-cost food, as well as where to donate food or volunteer. No one should have to go hungry.
Hi, my name is Dr. Claire McCormack and I am a GP at Haig Hall Medical Centre and Dementia Lead for Affinity Care. We have around 500 patients on our dementia registers across all sites, and this year we've started the process of offering everybody a face-to-face review of their dementia. We've ensured that our staff have had updates about being dementia friendly, and we've reviewed our surgeries to make them a little bit easier for people living with dementia to navigate, and this includes the installation of new signs. I work with dementia-friendly communities. I pop into some memory cafes to offer question and answer sessions, and I hope to expand this over 2023. We're also working with the Alzheimer's Society, who have provided us with a dementia support worker. This is a professional who is visiting various sites on a rotation, and they are there to offer advice and to support to people who have dementia and to people who are worried about the symptoms of dementia themselves. Remember that dementia is not just about problems with short-term memory. It can include our decision making, it can affect our speech and even our emotions. If you are worried that you have the symptoms of dementia or that one of your loved ones does, please make an appointment with your GP to discuss this. Otherwise, look out for the texts that come about where the dementia support workers are going to be next. Have a peaceful Christmas and all the best for 2023.
Hi, I'm Dr. Kathy Hart. I'm a GP and I've worked at Sunnybank Medical Practice for 10 years. It's Christmas Eve and we're all looking forward to a bit of festive spirit and a break. It's been a really tough year for most of us in one way or another. We started the year under COVID restrictions and we finished the year still seeing the impact of COVID on our society. This Advent calendar has been a way for us to direct people to resources they may not know about, organisations who can support them, and ways of managing conditions that are better off outside of primary care, for example, dental problems. The truth is that primary care and the NHS as we know it will never return to what it was before the pandemic. We have fewer clinicians and higher demand on appointments. We know it's frustrating to try and get an appointment, so we've had to find other ways of managing our patient needs more effectively. Our reception staff are highly trained care navigators, directing you to the most appropriate methods of care, and we can now offer evening and Saturday appointments. We are sad to say that we've had more abuse from the public in the last 6 months than we've ever had in the past. This is despite our staff working harder than ever before. You can tell from these videos how many telephone, face-to-face appointments, e-consultations, letters, emails, home visits and prescriptions we're managing daily. What you think you see us doing on the surface is only the tip of the iceberg. Despite these pressures and the inevitable stress we are feeling within our practices, we are reminded daily by our patients why we do this job. The positive and supportive comments we get, the presents and gratitudes we are gifted, goes a long way to keeping us going. We thank all of you for your patience and support during what has been the most difficult time most of us can remember. Please remember that kindness is at the very heart of what Christmas is all about. We ask you to continue supporting us and our colleagues in the NHS throughout 2023. Merry Christmas from everyone at Affinity Care.